you. Oh, thank you, Kimberly, for that wonderful introduction. I am Liana. Please feel free to call me Liana, and I am a licensed clinical psychologist with Cape Clarity Integrative Psychology. And I come here today not just as a clinician, but actually as a friend, and have personal experience in terms of blood cancer. So back in graduate school while I was actually working in oncology settings, one of my dear friends and colleagues was diagnosed with CML, and it was actually seeing her navigate not only the challenges of active treatment, but life after treatment. That really inspired me to help others navigate that really confusing time that comes after treatment and during that kind of end period of treatment itself. So when I speak to you today, again, it's not just as a clinician, but as a family member and friend who's walked alongside an individual navigating similar challenges as well. Before we get started, so the theme of today is the new normal, right? So Yvette was talking to us about survivorship, all of the things that are available to people who are considered survivors. And I want to focus on what that means for each of you. So there's a little handout in your red folder here, and it actually says the new normal. I'm going to have everyone pull out that handout. And as you're pulling it out, it says the new normal after blood cancer treatment ends. As applicable, I actually want you to cross out the on there for you and write my. So my new normal after blood cancer treatment ends, because this journey is specific to each of you. There's no general terms. You'll see some general terms on here. But as we're going through here, feel free to cross out what doesn't apply to you and actually star what maybe does, or some strategies that might be useful for you. And I'm going to have each of you taking some temperature checks throughout our talk here today, because as we're going through these different areas that are impacted as you're navigating this period after treatment ends, I want you to kind of focus on what areas that you feel like you're in like a green zone in terms of stress, right? Like it's feeling manageable. Maybe what areas you're in a yellow zone where you could benefit from some additional support, and where you're in a red zone where you're like, I really need access to support or some services that we've talked about here today, right now. So as you're looking at this, I want to check in, similarly to Yvette, what does the new normal, when somebody says that, what's a word or what's something that comes to mind when you're thinking of this? Acceptance. What are some other words? Just shout them out or raise your hand, whatever feels comfortable. Isolation, yeah. Anything else coming up for people? Oh yeah, not being able to do what you used to. And in what areas is that coming up for you? If you don't mind sharing.
No.
Okay.
How about putting up Christmas decorations?
Boom.
That was something that had taken me 5 days.
Yeah.
And I'm not done.
Yeah. So things are taking their time there. Yeah.
That type of thing. I was 6 weeks up and
So frustrations coming up as a result of that as well.
And a little anger in there, by the way.
Hey, we always talk about anger here. That this is a time that's confusing. There's both joy, hope, but there's challenges and difficulty in that as well. This element here, that's exactly what this space of this new normal focuses on, is adjusting yourself, adjusting expectations, adjusting your compassion towards yourself, in that life looks differently now. And all of what I'm hearing from each of you that's shared, and thank you so much for sharing, is that this new normal, whatever it is just not the same as whatever normal was before. There's an entirely different kind of experience that you're having in terms of this new normal. So that's going to be our focus during my part of our talk and our discussion here today, is what that new normal really looks like for you. And let's talk about some ways to actually navigate that together with community support, with individual support as well. So we're going to start with aspects, I believe, of some physical aspects. And I'll go through that pretty quickly. But what I'm hearing here from each of you is that there are challenges that come up, but then there are elements that help kind of cope with those challenges, right, of this new normal. Of like, fatigue is very real. Some pain is real, that loss of independence, or maybe the ability to get to do what you really want to do. And that can feel jarring, that can feel isolating in itself. And recognizing, and I always, actually, when I work with clients, we always eliminate the word small from our vocabulary, right? Because these are actually major things that you're doing on a regular basis, because each step that you're taking forward in terms of pacing yourself, maybe pacing activity, pacing kind of like yourself as you're reintroducing daily routines back into your life, that's actually a big step in the grand scheme of things. And it's something to celebrate and to acknowledge moving forward each of those times. The theme of today is that recovery and healing don't actually look the same for everyone, and it's not about going back to how things were, but it is about learning how to adapt in adapt to these new challenges. So we talked a little bit, and I heard from some of you about cancer impacting relationships. Over half of people diagnosed with cancer, and blood cancer specifically, over half of people feel more isolated after treatment ends and feel like withdrawn from their relationships. But there are also positive aspects, right, where our people, maybe our family members, are showing up for us, but they take that time to adjust of like, okay, I'm ready to reestablish what this normal means to me, and it feels like maybe you're still hovering or you've still pulled away, and actually communicating those boundaries effectively and clearly and without fear of how they're going to respond can be really helpful as part of those processes and navigating those relationship changes. We talked a lot about daily life. So daily life looks differently for people after treatment ends, and financially that looks different. I think I saw everyone nodding when Kimberly was talking about the financial impact of cancer, and that's something, the same thing also applies to household tasks. So like putting up the Christmas lights. That's a major thing that I hear from a lot of my clients about just how much that cancer impacts daily life and daily routines, as well as this positive aspect almost. And cancer is not something that anyone would ask for, but that there's a difference in priorities. I've worked with a gentleman recently, and he had mentioned to me, like, Liana, I don't just wait for joy to show up anymore. Now I'm changing where I'm shifting, what I'm really interested in, what actually matters to me, and maybe that's not your career at this point. And rediscovering what actually is true for you now is a really helpful part of, again, crossing out the in that new normal and actually circling on the my in that new normal as well. There's been a common theme here, though, and I'm a psychologist, so I focus on the mental and emotional. Has anyone noticed that a lot of what each of you have been describing, whether it's the physical impact, the relational impact, the daily life impact, impacts you emotionally, your stress levels, whether it's joy or sadness? There are so many emotions that come up at different points, right? So I'm hearing some positive ones, like some joy or happiness or wanting to engage with what matters. But then I'm also hearing that there's grief over maybe the life before cancer, that it feels like lost, or engaging in the things and differently now, some sadness that comes up, isolation and fear that come up. And these are all normal and understandable, but just knowing that they're normal, I always say, doesn't make it feel better, right? Like, it feels like validating to know that others are going through this, but now I want us to talk about some solutions of how to actually deal with some of these emotional impacts. So on the bottom of your sheet there's a little, I call it a flower, I'm not really sure, like a continuous circle, and we've talked about some of the hard stuff, and we want to talk about some solutions now. So as you're looking at that little circle on the front part of your page, I want you to just pick out one or two areas where maybe are your areas of like, okay, I want to improve in this area. This is an area maybe I'm not doing as well as. Maybe I want to, or where I want to be. And this is maybe your yellow zone or your red zone of that thermometer. So the first thing that we've talked about today is about community and resources and gaining that survivorship plan through either Sylvester or through BCU, accessing some of those resources. So I want each of you to just take a thought or have a thought and maybe turn to your neighbor and let them know. If you had a question today, who would you call? Does everyone have someone in mind? About blood cancer, about life after treatment, life during treatment? Kimberly is somebody you could call. So knowing, yes, knowing who your resources are when you have those initial questions, even if you're not sure what those questions are, just contacting and reaching out for support is going to be our first step, whether that's Kimberly, whether that's Yvette, whether that's myself, if you're wanting some mental health support. Knowing who you're going to call when those first initial questions come up are going to be really beneficial as part of your survivorship care plan. And that care plan is really focused on knowing who you need to get in contact with. If things are coming up in terms of like physical limitations, fatigue, in terms of like you need a referral to an occupational therapist or acupuncturist, knowing who to call, that's a first step there. And actually getting in contact with those people and going through your care plan as well as some self-care as well. So there's survivorship programs, we talked about community resources, and I want to talk and kind of blend the mindfulness and stress relief as well as the self-care and resilience. So this is you getting back to this different version of yourself, back to the things you enjoy, engaging with hobbies, maybe gentle movement, as Yvette was talking about in terms of gentle movement actually being proven. I think when I was meeting quite a few of you, I actually got you in it right away, right? When I was like, just go take a walk around here. Just take a look down by the water, sit with yourself for a second. And doing these things are really helpful in terms of quieting that voice of anxiety and actually improving and lifting mood, as well as combating fatigue. So does anyone notice that after they've like taken a walk, they actually feel more energized than they were when they started? Yep. So engaging in some activity. What about taking a deep breath? Has anyone done breath work before? And when you're feeling anxious, yeah. How does that feel after you take that breath? So much better. I think I saw some nods, a lot better. Just what that actually does is it calms down your nervous system, right? So if you think of anxiety or stress, it activates your fight, flight, or freeze response. And your heart might be beating, your breathing might be more shallow. So taking that deep inhale in through your nose and exhaling out through your mouth can help slow down that process, and that gives you the ability to better engage and respond to maybe anxious thoughts that are coming up as well, or doing yoga or light stretching, or just prayer or spirituality can be helpful in these areas as well. What about for the people who the hobbies that you used to do, they look a little bit different now? And I know you gave us an example, but did anyone else relate to what she was saying about the things that you enjoy looking a little bit different now, whether it's putting up Christmas decorations, which may have been a really joyful time, and now it's a little bit more frustrating? What about for others? Anyone else want to share? Yeah?
Like I can't get in the water.
Yeah. So not being able to actually get into that, and I imagine that was really soothing for you, and a place that again, there's that loss, and we grieve that as we're adjusting to this new normal. Whenever I work with clients like that, I always, in this loss of hobbies, I often say, well, let's take a mental vacation there, and let's actually derive elements of these things that you used to enjoy in a way that's actually tangible for you now. So I want us to do a quick exercise together here today. Well, we're going to do two, but this is an initial one. If you're comfortable, I want you to go ahead and close your eyes, and I just want you to picture the last time that you felt really relaxed or stress-free, really calm and safe and happy. Maybe you're outside in the sun, maybe you're in a colder area, maybe the wind is a little bit brisk, maybe you're alone or with another person. And just notice how it feels to envision this place. I see, as some of you have your eyes closed, that there are some smiles. And hold into where that feeling is showing up for you in your body. And notice what elements of this place are bringing you joy, or bringing you peace, or calm. And use all 5 of your senses here. So as you're seeing, maybe you're hearing the sounds of this place, you're smelling the scents of this place. Maybe you're envisioning what you're touching, whether your feet are on the ground or you're walking. And just allow yourself to really soak into this place. In a couple moments, I'm going to have you open your eyes, but take with you that feeling of that place. On the count of 3, 2, and 1, opening your eyes and returning back to the present. Would anyone feel comfortable sharing where they went for their calm place or their safe place? It's okay if you want to keep it private. To the beach, yeah. Were you actually at the beach right now?
I was.
Yeah, yeah.
I'm darn sure there.
Yes.
Forward.
Yeah. So I was in my mind, and that's an element, a small strategy that you can use. It doesn't replace it, right? It's not the same, but can we derive some elements of our safe and calm place, even if we're not able to get here? So even if we're not able to get there. A client that I worked with recently, his safe space was the top of a mountain in Denver, I believe, or outside of Denver, Colorado. And he wasn't able to get on a plane at every moment where anxiety spikes, right? That would be great, but that's not possible. And for him, hiking was something in terms of physical limitation. So what we did for him was something similar. Every time that he was having those moments, we would have him close his eyes, picture that place. Sometimes he would light one of those, like, I think they're called fir candles, like the tree-scented candles, to fully engage his sense. He'd have some light kind of sounds playing in the background with either the trees rustling or a bird chirping, and that was his 5 minutes that he would take to take that mental vacation. And that's something that I highly recommend, that as you're navigating stress or anxiety throughout your daily life, take that minute for your breath, take that minute for your mental vacation, because just like we did here together today, that was, I think, 30 seconds of a guided imagery or a mental vacation, and yet we already had some people at the beach and coming through smiling. So taking that time for yourself and noting what's going to be one of your +1 habits this week. So those are the strategies that I want to encourage each of you to engage with, in addition to checking in with yourself. So I know I talk about this thermometer a lot during today already, but really knowing when you're at that kind of like higher level of stress and anxiety, knowing what strategies are going to be most effective bringing you down from that red level to that yellow level, and from that yellow level back to that green level as well. And for many people, that involves some additional support, right? Some emotional support, some peer support like we have in the room here today or available through BCU. And that might look like support groups, or it might look like individual counseling as well. And a lot of the clients that I actually work with tell me often that they benefit from both that community kind of support in terms of navigating with other people walking similar paths to them, as well as that individualized support in terms of social workers, psychologists, or other counselors, that they're able to explore those what ifs or what now questions, or how do I navigate this in particular to me. So just spending time in a place that's, or spending some dedicated time in a space that's unique to you, while also relying on your community support. So we've kind of come full circle here, and that's not a pun intended, because I know there's a lot of circles on your handouts there. But I want to end on just this note of hope that actually came up from this corner here, of defining what meaning and hope actually look like for you in your kind of version of this new normal. So for many survivors, for many people navigating both during active treatment as well as life after treatment, there's this turning point where it's painful, absolutely, but it can also be deeply clarifying. And I'm looking at you here because I think what you were saying really resonated, right? Of like, I just have a different perspective now and different kind of priorities now. And that's called something that we actually term in terms of a psychological term as post-traumatic growth, where you've experienced something extremely difficult, but then you've gained clarity, or there's been some sort of positive impact that's come out. And this can coexist. So this hope and this fear or anxiety that occur can coexist. And when this kind of spikes come up, when this fear is getting in the way of maybe hope, it's important that you just reach for maybe one tool or one strategy that can really ground you and center you in those moments. So whether that's saying internally like a mantra to yourself of right now in this moment, I'm okay, or I'm not going to let this fear and anxiety steal my joy today, that's going to help shift your perspective as well as give some balance with that fear or anxiety. And it also shows up in gratitude. So noticing small joys like, hey, I got one more step on the treadmill here today, or I put up that Christmas light there today, or I talked to my daughter here today. Just noting one small piece of gratitude for yourself on a daily basis can also be centering as you're still navigating the fear and the anxiety that surround you. So I know that we've got a mindfulness activity that I wanted to get to after this, but I just wanted to thank each of you for really taking the time to be here today, for taking this moment for yourself. And I just want to check in. How are you all doing in this moment? Yeah, good. Better? Okay. I hope everyone can take one plus one strategy, or one thing that they can kind of focus on that's going to help center, help act as a stress relief, again, as you're navigating this time as well. And I think that, Kimberly, you mentioned that there's something to fill out. But again, thank y'all for your time today. It's been a pleasure.